Coming up.
Bring the body back into balance so the body could heal naturally, because the body is the greatest natural healer. And it turns out there's nutrient deficiencies in many diseases. Like if you think of chronic pain, it puts increased metabolic demands on the body when you're in chronic pain, or you're in chronic sleep disorder, right? So when you have an increased metabolic demand, it's like a car running uphill. It uses more gas because of the increased metabolism. So, or if you have a Tesla, right, it uses a lot more electricity if you're going up the hill. So that's the nutrient. So when you have these disease states at a cellular level, you have a nutrient deficiency of neurotransmitters, a relative nutrient deficiency because of that metabolic demand. And what these medical foods that I'm working with are doing, these encapsulated medical foods, they're providing amino acids to produce the neurotransmitters and bring the levels back to a balanced place so that the body is functioning optimally from a nutritional standpoint at a cellular level, and therefore the natural healing mechanism.
We have a special offer for our Munch Bunch listeners. To book a virtual consult with Megan, she's offering a discount of $25 off. Just email her, Megan, at nwmyofunctionaltherapy.com or through her website, www.orofacial-myology.com. To book a virtual consult with Kimmy for the $25 off, email her mouthmusclememory@outlook.com or through the website, www.mouthmusclememory.com. Now on to the episode. Hi, everybody. Welcome to the Munch Bunch podcast. This is Kimi Nishimoto and Megan Van Noy.
Hello.
Hi. And we have Dr. Mike Sinel. Dr. Mike Sinel is an author, and you might have heard of his book, Back Pain Remedies for Dummies. And then he also has written many other books, which I will let him speak to, but he specializes in spinal disorders and pain management from like a healthy standpoint. And we'll start with our affirmators and kick off the episode.
All right. We are ready to pull our affirmator for today's episode. So I've got our big old chunk here. You guys let the cards speak for us. Okay, Kimmy, tell me when to stop.
All right. Stop.
Ready. All right. What do we got? Oh, good. I love this. Gentleness. There's a cloud. Little gentleness here. So gentleness. I speak with gentleness and I listen with gentleness too. I align with the gentlest part of myself and I take joy in being receptive, open, and unafraid. I'm like a baby deer who's best friends with a baby elephant. The baby elephant wraps its little trunk around my shoulders and we lie down gently on the grass, daydreaming and talking about what sorts of humans the clouds look like.
That's so cute.
I love it. Cute.
I have been around baby elephants. They are the most gentle.
Oh, I love it. I love it. Oh, what a great way to start this episode. All right. Well, let's dive in.
Great. Sure. Thanks for having me. Happy New Year. So
Happy New Year.
Yeah. So yes, I trained as a medical doctor and specialized in physical medicine, rehabilitation, and pain management. And in New York, came out to California and became an assistant professor at UCLA School of Medicine, taught in the med school for 30 years, and was always sort of holistically oriented to a degree. I was trained very traditionally, but I always brought in the things I thought were important, especially to manage pain. So I brought yoga therapy into the medical school and mindfulness meditation, both which I got certified to teach, and ran a department at Cedars-Sinai Medical Center. Was in private practice and really learning from my patients over the years, because always looking for holistic approaches and alternative approaches if possible. Although I did have partners who were spine surgeons. So when needed, there was surgery and medications. But I also always try to, as much as possible, keep people off pharmaceuticals because of all the side effects. And used acupuncture, chiropractics, meditation, yoga in the practice, but then came across these nutritional approaches to pain in medical foods, these encapsulated medical foods, which when I was practicing, I owned a number of integrated clinics in LA. And when I was practicing, I saw these products that were all natural and had published double-blind studies against like the most common non-steroidal anti-inflammatories like ibuprofen and naproxen. And I was like, wow, that's incredible, because I have a lot of people taking anti-inflammatory medications and having lots of problems, upset stomach and, ulcers, kidney problems, cardiotoxicity. I mean, they have a lot of problems associated with them in big population studies. And especially seniors are really more susceptible to those problems. So started trying these natural products for pain and these medical foods, which I had never even heard of the category. So I'll take a couple minutes and define the category, if that makes sense, because I think everyone's familiar with supplements and everyone's familiar with pharmaceuticals, right? Like pharmaceuticals are either prescription or over the counter. And I certainly wrote a number in my lifestyle, and many people take ibuprofen and, melatonin for sleep. And then everyone knows supplements, which that's melatonin is a supplement, right? Or, for pain, people take turmeric or glucosamine or fish oil, right? These are all supplements that are affiliated with having effects for pain. But, the problem with pharmaceuticals is they're all associated with side effects and many drug interactions. So, they may be helpful if you really need an antibiotic for something, you may have to take it, but you have to watch them and be careful, right? Drug interactions and side effects. And the public has become very discouraged by many pharmaceuticals over the years. And then supplements, which many are terrific, but they're not regulated by the FDA. And it's sort of a marketing game to a degree. There's like thousands of supplement brands out there, and it's very difficult for the public to discern what really works and what's good. So the reason is a few things. There was an article on the cover of Time magazine years ago. They took like 100 different brands randomly off the shelves and found like a very high percent didn't have the ingredients they claimed to have in them, in the supplement. So they're not regulated by the FDA. Yeah, they're not regulated for their manufacturing, and they're not able to treat diseases or make claims, right? Because they're not regulated. So it's really difficult to say what is good, what is real. Most of them are based on theoretical scientific mechanisms as opposed to human trials, right? A drug gets based on human clinical trials. So I find this in-between category called encapsulated medical foods, which are FDA regulated, but they're all natural, right? And I was like, this is incredible. They're natural. They're completely safe. They don't have side effects and drug interactions. And they're regulated by the FDA for their manufacturing. So you get exactly what it says on the bottle. And the ones I got acquainted with were based on a messenger amino acid patented technology. So they were all amino acids and botanicals, and they were amino acids that are producing neurotransmitters that help regulate the body and really bring the body back into balance so the body could heal naturally, because the body's the greatest natural healer. And it turns out there's nutrient deficiencies in many diseases. Like if you think of chronic pain, it puts increased metabolic demands on the body when you're in chronic pain, or you're in chronic sleep disorder, right? So when you have an increased metabolic demand, it's like a car running uphill. It uses more gas because of the increased metabolism. So, or if you have a Tesla, right, it uses a lot more electricity if you're going up the hill. So that's the nutrient. So when you have these disease states at a cellular level, you have a nutrient deficiency of neurotransmitters, a relative nutrient deficiency because of that metabolic demand. And what these medical foods that I'm working with are doing, these encapsulated medical foods, they're providing amino acids to produce the neurotransmitters and bring the levels back to a balanced place so that the body is functioning optimally from a nutritional standpoint at a cellular level, and therefore the natural healing mechanisms. So
we want to introduce the spot for Tots Course, a parent's guide for toddlers ages 2 to 5 for mini myo. We have Megan and Kimmy going over nasal hygiene, myofunctional exercises, breathing exercises, tongue-tie healing protocols, and then we have Jenny June going over sleep hygiene and Kelsey Baker going over feeding therapy and bodywork. The course is $297 and the link will be in the description.
So I know that was a mouthful. Sorry about that, but the mechanism is super important. And,
no, that's perfect. Yeah, it's perfect. Well, and we talk about this, like optimal function is something that we talk so much about kind of in our kind of myofunctional lens of, you know, nasal breathing properly, lip seal, tongue in the right position, chewing and swallowing correctly. And all of those things are supposed to help translate to better sleep and better breathing and getting, you know, into that rest and digest and out of fight or flight. So this is just kind of like another perspective coming in to talk about what optimal function really looks like, kind of in all the different aspects, because, you know, for us, you know, this is our lens and, you know, and then your lens comes in. It's like we're filling in all the pieces of the pie to really help people get to that optimal function, which I think is really cool.
Yeah, I agree. And also, what you were saying about the neurotransmitters, it kind of ties into that episode we did with Miles about the gut brain vagus nerve connection, where most of your transmitters are in the gut and then they go up to the vagus nerve, but they're formed in the gut.
Yeah. It turns out also, like you mentioned, the autonomic nervous system, a flight, fright, like the nervous system is what regulates our cellular function throughout the body to a great degree. The autonomic nervous system, most of our society is dysregulated to a degree. Like our fight, flight, and our relaxation is very dysregulated. It's why we have all these things like proper sleep and breathing and yoga and meditation, like is to regulate our nervous system. So these neurotransmitters, when they get depleted, I mean, we're supplying the neurotransmitters through amino acids and technology to balance the nervous system. And one of the things that it's doing is regulating the autonomics, the flight, fright, the sympathetic, parasympathetic balance. And that helps dampen pain signals and inflammation. We have, again, you know, we have head-to-head studies against ibuprofen and naproxen showing that we could decrease inflammatory markers in the blood, decrease pain response with theramine, which is a purely natural amino acid and botanical-based product that's been given to over 30 million people over 10 years. Interesting to note, when I got acquainted with these were all prescription only back in the day, even though they were natural.
Oh, interesting. Okay.
And they were being reimbursed at $400 a bottle. And now I retail them at, you know, $60 just to bring them to the public and give you a big discount for your listeners. But, you know, so we have them for pain and for sleep and for cognitive decline and for fatigue and for neuropathy and an appetite suppressor for obesity. We have them for PTSD. We have them for, I mean, and all of these have been studied. I use them in my patients. We have lots of studies. We have a study with Centra PM against the biggest, one of the most widely prescribed sleep meds in the world is tryptophan. And, you know, study against that. So, yeah, these are incredible, natural, safe solutions that are proven to be effective, and they're not supplements. So you know what you're getting, and we're able to make claims because we're nutritionally managing these diseases.
So interesting. Do you guys have one that's like for adrenal support? Because I know that I and also Megan feel like our adrenals sometimes feel sucked dry.
Yeah, I bottomed out my cortisol earlier this year. Yeah, bad.
Yeah, so you know, these are supplying a number of neurotransmitters. We do have one called Centra AM that people take in the morning, which increases alertness and cognition and decreases fatigue. Because many people, when they say they have sort of adrenal deficiency, they're experiencing fatigue as the symptom.
Oh yeah.
Right? Like low. Yeah, and sometimes, you know, not the clearest thinking. And the Centra AM works really well, like as a morning pep, you know, and again, it's producing neurotransmitters, it's supplying amino acids, and it's working for fatigue and cognitive decline, and it increases alertness. And then the sleep ones also, you know, getting a restful sleep is really critical, right? So we have both Gabadone and Centra PM, both work for sleep. One is more for sleep with sort of anxiety when your mind can't stop racing at night. Another one is sort of just maybe low-level depression and sleep, because they tend to work for that. That's the Centra PM.
Interesting. And what sort of like, so most medicines have a botanical base, right? Like penicillin came from mold. A lot of the anti-inflammatories came from plants originally. So your supplements, like, what plant did they originate from?
Well, amino acids are like from both plant and food sources and animal food sources. Like these aren't vegan. So that, you know, the origin of both of these, I'm not, I mean, of the different amino acids, I've not dove deeply into them. There are also botanicals. There's things like caffeine and cacao and grapeseed extract that go into these that facilitate different cellular actions. So some of those are clearly caffeine from plants. I know cacao's from plants.
But yeah, it's more amino acid based than plant-based.
Amino acids with certain botanicals that interface in this amino acid technology and facilitate certain cellular mechanisms. It's like a 5-step process. The amino acids are precursors to neurotransmitters. So this 5-step process causes like cell uptake, and it inhibits things like tolerance and the slowing down of the production. So it's an interesting technology that's patented.
Yeah, that's so cool.
It's almost like at the cellular level. It's like you're not just masking the symptom. It's like you're actually going down to those base elements.
Yeah, I'm glad you said that, because that's exactly it. You know, I mean, we're not, you know, a lot of pharma, and this is a challenge practicing, was treating symptoms and putting Band-Aids on and staying on a medicine your whole life. Like if you have high blood pressure and someone says, well, here, take this and your blood pressure looks good, but stay on it. Like,
you can't go off.
Yeah, what's happening to medicine, which I'm very excited, and I think this is a really critical part, is we're trying to get to root causes of things and fix them, as opposed to just manage symptoms and keep you on a medicine your whole life. I mean, you may need it to some degree, but if you could get to the cause and decrease the usage of the medicine. And these medical foods, these encapsulated medical foods, often, like, I would see people in my practice on sleep meds or on pain meds, and I would add these. And as I would, you know, balance the cell at the cellular level nutritionally, we would slowly be able to decrease the medicines. And many people will get to a much, much lower dose or would get off. And some would just use it in combination at a very low dose. But at a low dose, most medicines have much, much, much less side effects, practically none. Our big study was against, like, was studied with naproxen, showing you could, which is like Aleve, a naproxen, you could lower the dose at 70% of naproxen when you combined it with theramine and have the same effect. And that would eliminate like 98% of the side effects. So.
Yeah, that's so interesting. So can people still take their medicines with these?
Yes.
Okay.
There's no drug interactions, no side effects. And many people do just still take them, especially when they're starting these. They're done under physician supervision. And if you're starting this, you don't want to just stop your medicines abruptly. So if you're on a sleep medicine or if you're on pain medicines, I mean, I have colleagues who have patients on opioids and lots of different pain medicines, medicine for neuropathy. So they'll typically start the medical foods and then just start to cut the dosing slowly as the patient tolerates it. But it's no problem to stay on both either. And these could be used in combination, both with each other as well as with prescription meds. Because again, they're amino acids and botanicals, so our body's producing these and they're natural. We just can't eat enough of these to meet these deficiencies. Like that's part of the FDA definition, that we're addressing a nutrient deficiency in a particular disease state that cannot be met with the normal diet. And then the ingredients all have to be GRAS, which means generally recognized as safe. So that's vitamins, minerals, amino acids, botanicals. The manufacturing has to be CGMP. That means good manufacturing practices, certified. Yeah. And then if you have a disease state that we're managing, you should be being overseen by a physician, have supervision for taking these.
I want to go back to what you were saying about like the NSAIDs. So I want to talk about like what is the long-term effects of NSAIDs, because I've had patients in the dental chair that have said like, oh, my husband is in kidney failure. I'm like, why is he in kidney failure? And they're like, oh, he took too much ibuprofen in his life. Or you hear about young teenagers that overdose on Tylenol. And then they get, damage to their liver. So like, what is the long-term effects of the NSAIDs?
Yeah, I mean, these are increasingly found to be dangerous. And it's interesting because they're so prevalent worldwide.
So prevalent. I mean, I have
beyond
several in my medicine cabinet right now.
Yeah, and you know what? In an acute setting, like if you take one, I got a bad headache, I want to stop it right away. Might some Tylenol or ibuprofen work, or menstrual cramps, might ibuprofen work fairly quickly? Yes. I mean, they're working on the pain signals, but they're not getting to the root problem, right? But so I'm not saying there might not be a place to use them, modestly and, and intermittently for a very short period. But the problem is many people, like you say, people like dental patients who have chronic TMJ, or facial pain. Many of them, just like many arthritic patients, just live on Advil, ibuprofen, Aleve, naproxen, and these things, there's kidney toxicity, there's thinning of the blood, there's cardiac toxicity shown in many of these. They could cause heart problems, There's lots and lots. The most prevalent thing is, God bless you, is gastrointestinal problems by far, to the point of bleeding ulcers and, and seniors, many of who have like chronic arthritis. I mean, they take these often for years and end up in the hospital with very significant or fatal side effects. When you look at the data on big populations, these non-steroidal anti-inflammatories are very dangerous for many people. And we also are finding out like the use of them in treating pain, we're seeing in many people, can increase the propensity when you use them consistently for more chronic pain and increased pain, which is real interesting. So they're resetting pain receptors in not a good way and making people more sensitive to pain. Yeah. So overall, they're not, there's a place for them, but I can't see anyone who needs an anti-inflammatory medicine not trying Theramine, which is all natural, and saying, hey, if I could just take the Theramine, great, because I could take it forever with no side effects and no drug interactions. And there's been 30 million of them taken over 10 years. And they used to be prescription only. The FDA says they're safe, and we have big studies in science. And then even if you still need your ibuprofen and naproxen, you could potentially take a much, much lower dose, which is way, way safer. And that's if you could take 70% less of a dose and have the same effect, that's tremendous for your health.
Yeah. Well, I know that like in my family, fibromyalgia is pretty rampant. Most of the women in my family have pretty significant fibromyalgia. And it's been interesting to see how the pain management doctors handle that depending on what state they live in because of the opioid crisis, right? So
I'm
for
excited.
example,
Okay. I'm excited to talk about this. So continue.
Yes. So for example, I have a family member that lives in Utah. Utah just legalized medical marijuana for pain management. So she is able to do a little bit of opioid with the tincture of marijuana that helps her with her pain. My mother lives in Idaho, which it's absolutely illegal to use any sort of marijuana. They drug test frequently with the pain management doctors. She is only allowed to do ibuprofen and her opioids. My sister lives in Washington. But she moved from Idaho. When she moved from Idaho to Washington and she asked her pain management doctor for her opioids, they tried to send her to like therapy because they said that she was a drug addict. She's like, no, it's just from Idaho. That's how we manage our pain there. So then she wasn't allowed to get anything except for ibuprofen, but she's like, I'm in chronic pain, so then she went to use the marijuana instead. So I think it's a nice intermediate thing because some people are not interested in using marijuana. They have either some sort of mental block about it or they have some sort of moral block about it. So I think this is a cool mix of like in between, like another option.
Mm-hmm. And for fibromyalgia in particular, I'm very glad you brought that up. So one of the previous chief medical officers of the company was a rheumatologist, and he was the director of rheumatology at Cedars-Sinai, another UCLA assistant professor. And he used to treat an enormous amount of fibromyalgia like myself, but he ultimately published something and had a protocol for fibromyalgia with these medical foods. So it's a complex problem, but if you think of some of the main symptoms of fibromyalgia, there's pain, there's usually fatigue, and they find out that many fibromyalgia, there's deficiencies in the sleep cycle. So if you look at pain, fatigue, and sleep as the three prominent symptoms, right? So he used a combination of three of these and had great results, and that became the protocol for fibromyalgia patients. So it was like Centra AM in the morning for pain, taking 2 capsules, for fatigue, I'm sorry, because Centra AM is that one I mentioned for fatigue and cognitive decline. And then Centra PM in the evenings for sleep, and that regulated the autonomic activity again, and that played a role in fibromyalgia, gave him more restful sleep. And then Theramine, which was the pain one, 2 to 3 times a day with meals, before meals, actually. So it was, Centra AM, Theramine, and Centra PM as a 3 medical food regimen for fibromyalgia. And I had many, many patients on it, and he did that for many, many years with excellent results and was able to get people down often off anti-inflammatories, often off even opioids. So
that's a big deal because the opioids, I want to talk about that too. They're not without risks as well. Like, how many people have you known that have died in their sleep from opioids?
Yeah, right now it's still a major crisis. I mean, it's killing, I believe, over 100,000 people a year still in the United States. I mean, it's more than wars, more than any war at this point. Young people have been killed by opioids, and it's often the vast majority, I believe now statistically, is from people starting on prescription medications versus illicit. And then, just like my neighbor who was, in his 70s, he had a shoulder replacement. He never did drugs. He was a very prominent attorney, and all of a sudden is like hooked on Oxycontin because he was managing shoulder pain. And the opioids are really, really dangerous in terms of their addiction potential.
Yeah. Oh gosh, that's so true. And yeah, so Kimmy was saying in her family it's fibromyalgia, in my family it's multiple sclerosis. My mom has
Ooh.
MS, and then actually, my dad had a traumatic brain injury 5 years ago that everybody at this point knows about. He had an AVM, that resulted in a lot of complications, deficit, frontal lobe stroke. And so I'm always looking for different things, especially for him, to help kind of bring that like cognitive neuro, get some of those, um,
Neurotransmitter
yes,
support.
the neurotransmitters going again for him. And it's so interesting now having like such experience kind of in all the different medications. And I think, Kimmy, what was it, 2 years ago, almost three, I think, that he had like a whole manic meltdown to where we actually had to admit
Mm.
him. We had to admit him to the like psychiatric ward because he was so manic that like he actually thought that my mom had a heart attack and died on the bathroom floor.
Mm, mm.
Called 911. The entire like the emergency service like in all of Sherwood like showed up to my parents' house trying to break the door down.
Oh
He called
no.
myself and all three of my sisters, like, your mom's dead, I need you to come to the house. And like luckily I had two missed calls, one from my dad and one from my mom, and I called my mom first and she was like, because I know better. And my mom's like, and he thought she was dead, like he dead, like they're, you'd be like, Dad, she's right in front of you. And he'll be like, yeah, she's here in spirit in our hearts. Like
Mhm.
she's always amongst us, right? So when we took him, he was telling the nurse, he was like, they're like, well, what's going on, Kent? And he's like, well, I'm really sad because my wife just died. And I'm like, Dad, she's literally sat next to you in the car as we drove you here. So, like he still
Wow.
has, yeah, so many brain deficits. And so I'm always like looking at like, what's the
Yeah,
what's something that can help him? Mm-hmm.
traumatic brain injuries really can be
Oh,
horrible. I'm sorry you've gone through that. I mean,
thank you.
we have seven of these amino acids that are producing the neurotransmitters, and we have them more for the symptoms like neuropathy. If you're getting
Mm-hmm.
nerve pain, they
Yeah.
work. And there are, I don't know like an indication for traumatic brain injury, but certainly people with traumatic brain injury, many are having sleep difficulties, many are
Oh,
having
yeah.
cognitive decline or fatigue or
Mm-hmm.
pain. And I think, again, the beauty of these is there's no harm in trying,
Right.
certainly specifically for
Mm-hmm.
some of the symptoms that may be showing up.
Yeah. Yeah. Because he's gonna eventually, they say he's gonna end up kind of in that Alzheimer's dementia space eventually. So,
Mm.
I'm always looking for ways to push it off as long as we can because he's young. He's just about to turn 60 in March.
Mm.
So he's young. So
Mhm.
yeah. Yeah, it's good. It's a wild story for a different episode, but um yeah, I think that's what's so cool and important to talk about with these medical foods is the fact that you can try them without worrying necessarily about these negative like interactions, right? There's so many times where they want to try out a new medication, but you can't take this or you can't do that, or if you're going to get off of it, you have to wean off of it, those kind of things. And I feel like that should kind of tell you something right there, about how the body, regulates those things.
Yeah, these are all about safety and a natural way to heal, to get the body in its optimal shape to heal itself and do its miracles, but
Mm-hmm.
using a targeted nutrition approach. And it's just very unique, very important category. I think pharma is
Mm-hmm.
realizing they're starting to put a lot of money and research into the medical foods arena because they realize like people
Okay.
are so oriented into natural, not and people are going supplements and you
Mm-hmm.
know but this is really bringing like very strong science to nutritional medicine. One of my partners is the head of Stanford's Health Innovation Lab. My other partner was the ex-CEO of GNC, and they're like, he's a real leader in the field of nutritional medicine and is so excited to see that we have human clinical data and are bringing like high level science and studies in humans
Mm-hmm.
with safety into treating these ailments.
Yeah, because that's such a huge thing. Like GNC, like think of how many products that they have, but like how many are like actually tested to the same level as your products. Like that's really, really cool.
Yeah, it's very exciting, and I hope you're able to help spread the word, because my goal and mission in taking over this company is really because I treated so many patients successfully with these and seen so many doctors, and it used to be unaffordable for people. I mean, it was $400 a bottle, so now you're going to be able for under $50 a month or less for the discount code you have for your clients. And they're just really important to try and see if you could avoid certain pharmaceuticals or just help with symptoms.
It's like the ultimate root cause. Like you're literally at the cell. So small you can't even see it.
Exactly. So, I even have a couple patients off the top of my head that I can like think of. I'm like, I'm gonna talk to them about this when I see them, this week and next week. So I'm excited.
Great.
So going back to neurotransmitters, is there any like products that you have that have utilized anything from a mushroom base? Because that's like a really interesting topic now after like the Fantastic Fungi movie is like all the amazing medicinal properties of mushrooms, whether they're the edible version that we eat for food or the psilocybin, because the psilocybin has been proven to like kind of flush those pathways as well. Do you utilize any mushroom-based things?
Well, these are like I came into this company after these were developed, because as I said, they were prescription only. So I wasn't involved in the initial inventions and manufacturing. I was just the doctor who was like, wow, these are working on like millions of people or hundreds of thousands of doses. And I want to help get it out there. I mean, I'm a huge advocate of the roles of mushrooms, and, I invested in a mushroom latte company, Everyday Dose, and it uses Reiki and all these different mushrooms. I think are doing really well for people. But these are very specific formulations that can't be altered and have been around like 15 years.
Okay. I actually was like looking at buying that one. So I'm glad you said that, because I saw something that said that it was better than mud water, and I almost bought mud water. Do you like it?
Well, much better from a taste perspective. And I tried mud water once, and that was it. But yeah, the Everyday Dose I have and I use and I love, and was just speaking to the founder and turned a lot of people onto it. So it's a great one.
Okay, I'm going to have to try it. I'll let you guys know.
Yeah, keep us posted. I love it. Well, so if people were interested in purchasing these medical foods, where would they find it?
Medicalfoods.com is our website. So that's nice and easy, right? Easy. Medicalfoods.com. But we're giving a nice discount code for your listeners. So
thank you.
You could have that information that you could post, and they could go to medicalfoods.com. And it's a very deep website, like layers and layers. If people want to go into research and white papers and science, it goes on and talks about the studies against some of the big pharmaceuticals and treatment. And again, this is for everything from obesity, neuropathy, PTSD, fibromyalgia, just general chronic pain and inflammation, osteoarthritis, sleep disorders with anxiety, depression, cognitive fatigue, cognitive decline and fatigue. So we have a lot of products for many, many different ailments, and medicalfoods.com has all the information people can want.
That's cool. Thank you for sharing that. And thank you for the code for our listeners too.
Trying to affordably spread these large scale for people.
Beautiful.
Yeah, I love it. Oh, man. Well, I learned so much today. I'm really excited. I'm excited to try them, excited to go read all about them. I'm glad that you guys have the research on there too, because that's, so much of what people will ask us, about the research or where can we find it. And, so I think that's awesome that it's just so kind of open access to everybody. And that way, you know, everything can be really just transparent and there's no barriers to trying those things, which is really cool. So, oh, Kimmy, is there anything else that you want to ask before we wrap it up?
No, I think we covered everything I was interested in. We talked about mindfulness, mushrooms, you know, all the things I love.
I know. Great way to start the Tuesday morning here. I love it. Well, are you on social media at all? Do you have any other ways that we can find you?
Yeah, I mean, I'm on Instagram. I think you have all these links: Facebook, Instagram, Twitter, you know, but it starts at medicalfoods.com, and then I think everything is there. But my Instagram is Dr. Michael Sinel.
Perfect. Awesome. Yeah, we always like to say it out loud too for our ones who are always listening versus the watchers. So perfect. Yes, we will get you kind of linked into Instagram. And of course, if you guys want to find us, you can find Kimmy at Mouth Muscle Memory. You can find me at NWMFT, and you can find us both at the Munch Bunch podcast.
Great.
So thank you so much for taking time out of your morning to hang out with us and talk to us more about the medical foods. And I'm very excited to try them.
Thank you so much. Really, really appreciate the time. And hopefully your listeners will benefit from these.
Yeah, absolutely. So that's exciting.
Thank you.
All right. Bye, everybody.